All right. Hi guys, Sensei Derek here again. Back with another breast cancer recovery video. And I'm trying desperately to figure out what two men are doing in a breast cancer video.
Well, my name is Michael Singer and I'm a 6-year breast cancer thriver because men get breast cancer too.
Yeah, actually, it's about 1% of breast cancer cases are men. It's something like 2,400 men a year are diagnosed with breast cancer. So, we want to speak to some of the things that go along with part of men's recovery. Although this next technique is definitely applicable to men and women. We're going to get a little bit of this like chest and pec area, sternal rocking, and then we'll get to the pecs. So I've got just a big squishy sort of inflatable ball here. I like the size, good size, a nice give to it. So grab that ball. I want you to place it right in the center of your chest, right at your breastbone, where you can give it some real pressure. Sort of notice what it feels like. Push as much as you want, but don't go, crazy. The intensity level we can start to ramp up. And then with that pressure, start to roll it over to your right side and then look over towards the left, move your head, and then vice versa, come back into center, roll the other way and look the other way.
Should I switch hands at this point?
You can do whatever feels easy for you. What I want you to do is sort of roll up, sort of back and forth across your chest. You can go up and down. This is one of those instances where, with a male thriver, you might find you have a little more room to go up and down. You don't have implants in the way. You might have less sensitive tissue. But this is also a great technique for women to work on, just to open up and soften some of this tissue. Obviously after surgery, this is, pretty tender, pretty sensitive. So you can do that left to right. Again, a couple minutes would feel nice. And then let's go right to the pec. So let me borrow this from you. If you reach your arm straight out in front of you, you see this little fold of the shoulder of the armpit. I want you to put the ball right in front of the chest, pretty close to that line. You can go up above the armpit, so you're really in this pec tissue, and you'll kind of feel a little meatier chunk of real estate there. Once you've got it, give yourself a pretty good push in the ball. Like you're kind of trying to flatten the ball out a little bit. You're going to reach your arm out to the right side, and this is where you'll mitigate the intensity. So how far or hard you reach your arm is up to you. And then again, you're going to start out nice and gentle, and over time start to get a little more intense reach, a little further. And then roll your palm up to the ceiling. You can wiggle your fingers, circle your arm out. Really any movement of your arm that feels good here. You can even give like a little, I don't think, like a quarter of a snowman up and down. Yeah, and then take a big breath in, reach as much as you want to, and then let it go. So go ahead and do this on both sides, even if you've only had surgery on one side, just so you have a nice even width across your chest. How's that feel?
It feels good.
Excellent.